Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. The state of the COVID-19 pandemic in our province has grown more serious. We're here a day earlier than scheduled to explain these developments and to announce restrictions to stop the spread of the virus. Our case numbers are rising too rapidly, and there is now community spread within Halifax Regional Municipality. Today we're announcing 38 new cases, joining the 25 cases from yesterday. Case numbers haven't been this high since we put restrictions in place in November during the second wave. There are 111 active cases across the province and 3 Nova Scotians in hospital. Make no mistake, there is a lot at stake here. As you already know, today at 8 a.m. new restrictions were put in place at our border for 4 weeks. We're asking Nova Scotians not to travel outside of Newfoundland and PEI unless the travel is essential. If you're not a permanent resident of Nova Scotia and your travel here is not essential, you cannot come here. Our COVID website will have more detail on what is considered essential and what is not. And understand that we are prepared to turn away people at our border. These measures will help, but they aren't enough on their own. Over the last several weeks, Dr. Strang and I have consistently warned Nova Scotians that in this fight against COVID-19, none of us can let up. We've all seen what's happening outside of our borders where some variants have gained a foothold. No one wants that. Right now, our immediate concern is the COVID activity we're seeing within the Halifax area. That's why, effective tomorrow at 8 a.m., we are introducing new restrictions for all of HRM, as well as a number of communities in the surrounding area. We are implementing what is almost a full lockdown, and it will be in place for the next 4 weeks. Dr. Strang will go through them in detail, but I'll say this: these restrictions are meant to be a circuit breaker. They are designed to curb social activity so that we can protect our healthcare system from surges and keep our vaccine rollout on track. Here are some of the key new restrictions. Nova Scotians should avoid all non-essential travel in and out of the Halifax area. We are not allowing visitors to our long-term care centres, with the exception of our designated care providers. Effective tomorrow, schools in our area of increased COVID activity will close to students and move to at-home learning for a 2-week circuit breaker period. These are Auburn Drive High Family of Schools, Cole Harbour High Family of Schools, Dartmouth High Family of Schools, École Secondaire Mosaïque, École du Carrefour, and École Bois-Joli. Teachers and school staff will continue to work in school. The indoor and outdoor gathering limits will be set at 5 people. Public servants will work from home where possible. Retail, business, and malls stay open, but at 25% capacity. Restaurants will move to takeout service only, and personal services will be closed. Again, Dr. Strang will go over some of these new restrictions in greater detail. This circuit breaker will reset the concerning activity we're seeing in the Halifax area. We need to cut off the spread of the virus before it becomes a bigger issue or expands to other parts of the province. I know that these measures are tough, but I want to reassure Nova Scotians we will be working with them to mitigate the impacts that this is having. Our government will ensure we have supports for businesses affected by this partial lockdown. The Small Business Impact Grant will be made available to help affected businesses. I want to remind Nova Scotians that these measures do not further restrict outdoor spaces. People should be continuing to go outside and enjoying our parks and playgrounds. Everyone, I know we are entering a difficult period, but there remains reason for optimism. You can see that by looking at the lines of people getting tested. Throughout this pandemic, Nova Scotians have shown the will and the capacity to fight COVID-19 and to win. We've done it before, and we'll do it again. While these new restrictions are set initially for the next 4 weeks, we will be adaptive in their application. We're constantly reviewing the epidemiological situation in the province. If we see after 2 weeks that our public health measures have had the necessary impact and that moment is suitable, we will look at starting to open up. If we succeed together in forcing the cases down, we can start to let up on restrictions. I'll give you a quick update on the vaccine rollout before I turn it over to Dr. Strang. As the end of day yesterday, we had 25.5% of Nova Scotians receiving at least one dose of vaccine. That's 247,312 doses administered across the province, and yesterday the clinic staff delivered a record high of 16,511. I'll remind you again that given the reduced supply for this week and next, there could be fewer appointments in the system. If you haven't been able to book an appointment yet, please be patient, and let me underscore that our new restrictions will not hamper our vaccine rollout. As soon as your age group opens up, you'll still be able to make your appointment. Whether it comes to vaccinations, to new restrictions, or our daily lives, I'm calling on all Nova Scotians to be cautious and follow public health protocols. Now is the time to fight the virus. Together we will get through this. I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everyone. I had hoped we wouldn't need to bring in more broad public health restrictions in addition to the border measures that came into effect this morning. But after talking with my team about the cases they were investigating, it is clear strong action now is an absolute necessity. Last week at this time, we had 42 active cases of COVID-19. Most of those were related to travel or closely connected to a travel case. Today, we have 111 active cases, and we're seeing community spread and cases with large numbers of high-risk contacts. The biggest cause for concern is the greater Halifax area. That is why we're bringing in restrictions for Halifax Regional Municipality and nearby communities for 4 weeks. With hard work, if things start to improve, we may be able to loosen restrictions a little earlier. The intent of these restrictions is to keep people home as much as possible. As before, when we've done this, go to work, go to school, get your essentials, go to your medical and other necessary appointments, including your vaccine appointment, but otherwise stay home. This is even more important now that we have widespread of variant strains, all of which are much more easily passed from one person to another. If we can reduce spread in the greater Halifax community, we can keep schools open, protect our healthcare system, and keep our vaccine program on track. So let me walk you through the restrictions. People should not travel in or out of the affected areas unless it is absolutely necessary. Unnecessary travel includes going to school, work, or for legal or healthcare reasons. Shopping, social events, family visits would not be considered necessary. The household gathering limit in the restricted area has been lowered to 5, but a larger family can still live together and be together when they are out in the community. There can be no social events, special events, festivals, arts and cultural events, sports events, faith gatherings, wedding receptions, or funeral visitations or receptions. Wedding and funeral ceremonies hosted by a recognized business organization can have 5 people plus officiants. There can be no sports practices, training, games, competitions, or tournaments, or no arts and culture rehearsals or in-person performances. Indoor fitness facilities like gyms and yoga studios and sport and recreational facilities like pools, arenas, indoor tennis courts, and large multi-purpose recreational facilities are closed. Recognizing the importance of physical activity for mental and physical health, people can and should get outdoors. We encourage people and families to do that. Outdoor activities are not restricted as long as people maintain gathering limits and physical distancing requirements. Fitness and recreational businesses can operate with 25 people and physical distance, and that is outdoors. So you can have outdoor fitness classes with appropriate distancing with up to 25 people. Golf courses and outdoor tennis courts can also operate, but any associated on-site restaurants or licensed establishments must close to seated service. Any businesses that offer indoor recreational activities such as indoor play areas, arcades, climbing facilities, dance classes, and music lessons are closed. Museums, libraries, and the Nova Scotia Art Gallery are closed, but libraries can offer pick-up and drop-off books and other materials. Masks are encouraged everywhere, and they are now mandatory in all common areas and places where there is interaction with the public, areas with poor ventilation, and areas where distance cannot be maintained between employees in private indoor workspaces. So we are extending our masking requirements in the Halifax area into all those places in private workplaces. And now I'll talk about schools and daycares. Daycares will remain open. Most schools will stay open as well. Where possible, children and youth need to be in school for their education, social and emotional development, and mental health. We have done an amazing job of keeping children and youth in school all year. There are certainly not many jurisdictions in Canada that can say that. But our schools are being impacted by increased COVID-19 activity. This week, we've seen a number of COVID-19 cases connected to Halifax area schools and some of the hotspot areas. That's why some schools will be closed for 2 weeks starting tomorrow, April 23rd. All other schools in HRM, as well as those across the province, will continue with in-school learning. Also, beginning tomorrow, masking in our schools will extend to all students, pre-primary to grade 12, in regional centers for education. So across the province, we are now requiring masking in all grades, not just grades 4 and above. We have acted quickly in response to cases in schools, and we will continue to do so. And we will not hesitate to close another family of schools if we determine that it is needed. I know that none of this is welcome news, but unfortunately restrictions are needed. I expect to see high case numbers in the coming few days. We've significantly ramped up testing, and I do want to thank everyone who has come out to get tested. More testing often means more cases identified, and that actually is good news. We want to identify cases, isolate them, quarantine their contacts. This is how we help stop the virus in its tracks. I also need to clarify a few points related to the border measures that we introduced on Tuesday. First, the approach we're taking at the border depends on where you're entering from. There are no restrictions for people coming from Prince Edward Island or Newfoundland and Labrador. Our border restrictions for New Brunswick have not changed. There is a 14-day quarantine for people who enter from New Brunswick unless they fall under one of the circumstances outlined in our Nova Scotia-New Brunswick travel protocol, which allows exemptions, but certainly protocols that people have to follow to reduce their contact with others. And some of those are frequently crossing the border for work or school, necessary trips, one-off trips that people have to do. So all of that information in our Nova Scotia-New Brunswick travel protocol is online, but that has not changed. What is new is the ban on non-essential travelers entering Nova Scotia from outside Atlantic Canada. There was a lot of confusion, people feeling that what we'd instituted was also applied to New Brunswick, but we needed to correct that. That is not the case. The second item I want to clarify is people who are looking to move to Nova Scotia during the next 4 weeks that the border measures are in effect. If you're moving to Nova Scotia, you can enter as long as you can provide proof of residence or job status. You need to be prepared to show documented proof to border officials, and that documentation would include one of the following: a purchase or sale agreement showing an offer on a property that has been accepted on or before April 21st, and that the closing date is on or before May 20th. A minimum 1-year lease that is signed on or before April 21st, 2021, and to take possession of the leased property on or before May 20th. And the third one is a letter of acceptance for new employment, whether that's seasonal summer employment or longer-term employment. That letter of acceptance that is in Nova Scotia that was before April 21st, and a self-isolation plan. So you're allowed to come here to accept a job, but you have to have a plan that would show how you're going to quarantine for the first 14 days. No matter where you live in the province, you are affected by these border measures and restrictions. And I want to thank all Nova Scotians for their continued support, hard work, and commitment to keeping Nova Scotia one of the safest places in the world. We have been at this a very long time. I know many people are tired, many are frustrated, and probably all of us are worried. But we cannot be indifferent or complacent. If we don't take our current situation seriously, it could take a very wrong turn very quickly. We have a chance to reset and get Nova Scotia back on track, just like we have done before. We are putting the right things in place to be successful. Border measures, increased public health restrictions, and increased testing. If we need to do more, we will, and we will do it very quickly. But there are also things that we need every Nova Scotian to do. One person's actions can make a huge difference. It only takes one person not complying with quarantine to infect many other people. Individual actions matter, so please make them count to help things turn around. Make the right choices about your social and discretionary activities. Limit your social contacts. Stop doing things that are not necessary. Stay home when you're unwell, even if you may have just one mild symptom. And get tested. The more contacts you have in your life, the more frequently you should be tested. Don't travel unless you absolutely have to, and whatever you do, do not knowingly socialize with anyone else who has traveled and is quarantining because of that, or maybe they're quarantining because they're a close contact. And please book an appointment to get your COVID-19 vaccine as soon as you're eligible. If we all work together like we've done before, we can protect each other, our communities, our health system, and our vaccine rollout. This is in our collective hands. I'll be honest with people. This situation scares me, but I know we have the ability to regain control. However, this will take the commitment of every Nova Scotian. But I'm confident that we have shown we are up to the task. So please continue to care for one another, build up our communities, use your common sense, and keep each other safe. Chrissy.
We'll now take one question and one follow-up in the time that we have for today, beginning with All Nova Scotia's Lindsay Armstrong.
Thank you. Dr. Strang, given the new case levels today, I'm wondering if the epidemiology has changed to warrant opening up the AstraZeneca eligibility to allow more people to get vaccines. Have you considered this, or allowing people who've already had one dose to get their second dose of AstraZeneca more quickly?
No, we've looked at this. We're still within the threshold of the epidemiologic limits that NACI is using. We're still what they would call in a low epidemiologic position. Everything we're doing is to keep us there. And being in that low epidemiologic position, the NACI recommendation would be that we maintain the use of AstraZeneca for the 55 to 64-year-olds. Lower age groups, even in our condition is epidemiologic now, still there's a greater risk of a severe adverse event from the AstraZeneca vaccine than an adverse outcome from COVID. So, but however, that vaccine is still there for Nova Scotians 55 to 64-year-olds if they want. We had 1,600 people make an appointment for AstraZeneca yesterday. So it's there. If it's not used, it doesn't expire till the end of June. So we're going to keep that vaccine in our fridges, and who knows where our epidemiology is going to go. So we'll make decisions about potentially opening the use of vaccine guided by our epidemiology in the coming weeks. So the vaccine is there, it's being kept safe and stored, and we'll figure out the best way to use that over time.
Go ahead with your follow-up, Lindsay.
Respectfully, Dr. Strang, I have heard people be quite concerned that they can't get this vaccine that they feel very comfortable with taking, understanding the risks, knowing what other provinces are doing to open this up with a case level as high as we've seen today. Is there no urgency to sort of get more vaccinated people, given that we are expecting a reduced load next week, as you mentioned?
We have a small dip in because of our Moderna supply, but we're still on track using the mRNA vaccines. By 2 to 3 weeks, people in their 40s will have the opportunity to get an mRNA vaccine. We feel that's the best approach. Given the epidemiologic position, we don't feel it's justified to put people in the position of having this using a vaccine where there's a greater risk of a severe outcome from the vaccine than there is from the disease. That may change, but right now that's the position we're in.
Next question will go to Shayna Luck with CBC.
I'd like to understand more about what plans you're making in case of further spread in schools and daycares, and what kind of triggers would cause you to put that kind of plan into effect?
So we've the three families of schools where there has been multiple schools affected, some of them with more than one case, and we know there's a lot of disease activity in those surrounding communities that we're saying that we need those schools to be closed for 2 weeks while we try to get the community activity down. Schools are not the place where disease is by and large being spread. The schools are at risk if there's a high degree of activity in the community. Outside of that, we'll continue to watch closely, like we've done since last September. When we have a case in a school, an individual school, we identify all the close contacts of the school, we isolate them, we test them, we close the school down until we get all those test results back. We'll keep using that approach, and it's the same approach we've taken if there was an individual daycare. If we start to see multiple schools in a family of schools, and we're also concerned about the community activity within which those schools are situated, we would take similar actions like we're doing for the three family of schools today.
Go ahead with your follow-up, Sheena.
Dr. Strang, this is a very large number of schools that we've seen closed. What are the contact tracers telling you about why this is happening?
By and large, what we're seeing is people who happen to, whether they go to school or they're work in a school, the exposure is not happening in the school. We're not getting transmission by and large within the school. What is happening, because we have lots of disease activity out in the community, it just so happens that people are exposed and become infected out in their community, and now then they have to be in school while they were infectious. Fortunately, as we continue to see, and by and large, as we the contacts in schools, as we isolate them and test them, we're not seeing very many cases occur from that. We're not, since September, we've had lots of cases in schools, and we have not seen schools have a significant transmission of virus in the schools.
Next question will go to Tim Biscay with Halifax Examiner.
Just to follow up on that school question. In previous small outbreaks that we have, we really haven't had that much in the way of school outbreaks, and there is a bunch happening right now. You had previously mentioned some community event that was a precipitator for a bunch of cases. Is there some connecting event between these school cases, an after-school activity or PD day camp, something that connects them?
So I think what we've seen in the family schools, two things. So you use the word outbreak. Just because we have a case in a school doesn't mean there's an outbreak in the school. There's two very different things. There's schools that an outbreak would be when there's transmission of the virus within the school. Again, what we're seeing is people infected in the community who happen to work or go to the school, and then they're identified, and they were in the school while they were infectious. We're not seeing any signs of transmission within those schools, so that's not an outbreak. I just want to make that clear. Yeah, there was an event back, that triggered much of this, but there's been multiple layers of transmission now that we now have spread within community within significant parts of HRM, which is then resulting in cases in schools, cases in long-term care facilities, cases in workplaces.
Go ahead with your follow-up.
There's a great deal of interest out there, and so I wonder if you could just explain what public health's approach is to when you learn through contact tracing that there were events that shouldn't have happened or people violating public health laws. I could see it going both ways, that you might want to encourage people to be truthful so you don't want to criminalize them, but on the other hand, they are breaking the policies. So what is your approach to that?
Yeah, our end goal is not about trying to find people in enforcement, but if it is part of our investigation, ultimately we end up with definitive information that it has to be definitive, that we could say that was clear, an individual or group of individuals made a clear violation of rules. We would bring that to the attention of law enforcement. But that's not the purpose of why we do an investigation, and we make that very clear to people, that we're not there to try to find people so they can be punished. We're there, we need good, accurate information so we can get in control of the disease. But in this circumstance, we haven't got that definitive information, and it's happened. Unfortunate. Now we have to deal with what we're dealing with in the HRM area and bring things back under control.
Next question will go to CTV's Sarah Plowman.
Good afternoon. This is a question for Dr. Strang. Sort of going off of what Tim was saying, is this cluster that you're talking about, is this sort of catalyst moment that you're talking about, is this a result of when family and friends gathered with people who recently came from Ontario. And I'm wondering if people have been fined in this case. You know, we did ask police this yesterday. We asked the province this yesterday, and sort of the province told us to go to police, and the police told us to get more information from the province. I think a lot of people want to know whether anyone's, you know, faced any consequences here.
Yeah, we know there was an event where people from out of province. Now, we haven't been able to follow up those people to confirm that they were infected, but that's the likely scenario. We don't have definitive information, as I said to my previous answer to Tim, that we would actually go to police with something. So nobody's been fined. The focus of our investigation ultimately is not to try to find somebody to penalize them. We'll pass information along if we get it. But our focus is to really find out how a virus got here and how it's been spread, and now we have to focus on trying to control that spread.
Go ahead with your follow-up, Sarah.
We know that there were 8 COVID cases at 8 different schools in HRM in just 72 hours. I understand that, there's going to be enhanced masking guidelines now. That's something that the teachers union has called for. But they also want to see vaccines prioritized for teachers. Is this something that you're looking at? And can you also talk to whether schools are safe for students and staff?
So we still feel schools, by and large, are safe with the measures they have in place. We've shown that since September. What makes schools potentially unsafe is high levels of virus out in the community. So we all have a responsibility to keep our virus levels low in our communities to keep our schools safe. Keeping kids in school has to be one of our priorities. So we all have to take responsibility and then do what we can do to continue to keep our schools safe. We certainly have heard from teachers. The reality is that we're now offering a vaccine for 55 to 64-year-olds AstraZeneca, 60 to 64-year-olds and above. It'll be in the second week in May when we're into 40-year-olds immunizing. You've seen over the last few days, and there's been media reports about the success of our age-based approach to rapidly ramp up the speed of delivery of vaccine. If we were to try to organize this approach specific for teachers, we'd take ourselves off that task. In the coming weeks, teachers, along with everybody else, will get opportunity to get vaccinated.
Next question will go to Elizabeth McSheffrey with Global.
Hi there. My question's for Dr. Strang. Fair to say that Nova Scotia has entered the third wave?
Yeah, the reality is you're absolutely right. We're here the third wave, like other parts of the country. But again, we have an opportunity by acting really early. We've seen what neighboring provinces, Newfoundland, New Brunswick, how they acted when they had their third wave. We're doing the same thing, and I'm very confident that we'll have the same impact and the same success that Newfoundland and New Brunswick have had.
Go ahead with your follow-up, Elizabeth.
My next question is a bit similar to what some of my colleagues have asked. It wasn't so long ago that the messaging we were getting was that, young people, youth were, spreading the virus through social activities, taking a mile when given an inch with some of the public health protocols. Do we still have the sense that this is, being spread by young people, or have we gone back to sort of all manner of ways that the virus is being spread?
So we've never said that it's just young people. Certainly people of younger age groups are more likely to be, because of the phase of lives they're in, that they're more likely to be socially active, but people of all ages are socially active. And what we're seeing is consistent. It's the social activity where we see many people now, when they're a case, identified as a case, and we do the follow-up, they have multiple high-risk contacts because of, active social lives and doing all sorts of activity with other people. All of us, what we need to do now is slow down the pace of our, what I call the discretionary things in our life, the things that we have choice over, and reduce the number of people we are in contact with. That's critically important. We all think about, what do I need to do? How many people do I need to be in contact with? And what kind of contact is necessary? And we need to reduce our close contact, reduce our number of contacts, reduce the number of activities we're involved in.
Next question will go to Keith Doucette with the Canadian Press.
Yes, this could either go to the Premier or Dr. Strang, and it's based on the decision yesterday to to cancel the Women's World Hockey Championships. I think, given what you're saying today, it makes sense perhaps to people in Halifax and to people in Nova Scotia, but there are a lot of people outside of the province who are frankly scratching their heads, given what Dr. Strang's comments just 2 days before. Can you tell us, besides the numbers, what's really changed here, just to clarify the stance? Because I do know for a fact there's a lot of people outside of the province who are wondering about this decision.
Well, I think the reality is it's not essential, and it's hard to tell Nova Scotians not to come in and out of HRM. But yet we're going to make an exception for a group of people. Yeah, I'm a hockey fan. I'm not happy with the decision, but we have to put public safety first. I think most Nova Scotians realize, and it's impacting their lives when they're not able to go to their own kids' hockey game or to go visit family outside of HRM. We have stricter border measures in place now, so I couldn't conceivably ask Nova Scotians to restrict more of their lives and make an exception to have people fly in to Nova Scotia from other countries.
Go ahead with your follow-up, Keith. Keith, do you have a follow-up?
Sorry, I was on mute. Premier, so it seems to be a pretty straight-ahead decision for you, but was there any back and forth with Hockey Canada, given the success of other events, basically, that were walled off, and given what Dr. Strang said about how the tournament was walled off, was there any chance that you talked about perhaps considering them having the tournament without fans, because there were going to be limited fans there, or was it just a straight decision for you?
Given where we are today, it's a straight decision. We did have that conversation, Dr. Strang and I. I had full confidence that they were working through an achievable plan to keep people safe, and we could have scaled back with that plan. But the organizers were well aware that if our epidemiology changed, that we would have to shift. So we're in a very different place, as was highlighted by Dr. Strang today, than we were a week ago. So I think that most people would recognize that we needed to make a decision that was in the public safety's interest.
Next question will go to John McPhee with the Herald.
Thank you. This is for Dr. Strang. You say this situation scares you. That's not a word that you use very often. You're usually pretty cautious in your language. How bad could this get if these restrictions don't work?
Well, I think what scares me is you have to look in other parts of the country where they haven't been able to get this under control. But I'm also confident we're acting very firmly, very early. As I said, I used my neighboring provinces as examples earlier. New Brunswick and Newfoundland have had similar situations. They both have acted firmly and early in parts of their province, or Newfoundland, it was the whole province, and it has worked. So I'm confident that we're doing the right things at the right time. But for it to work, every Nova Scotian has to buy into this and step up their game and do what we're asking everybody to do to keep each other safe.
Go ahead with your follow-up, John.
Thank you. I believe there are 10 cases where the source of the infection is not known. They're under investigation. What is the level of community spread right now? I mean, in terms of the numbers of communities where you are fairly certain that there is community spread?
I think it's safe to say we've got evidence of community spread throughout much of HRM. That's why but not outside, fortunately. So that's why we're using HRM and some surrounding communities as our geographic boundary with it. All these restrictions pertain.
Next question will go to Victoria Walton with the Coast.
Thanks. Dr. Strang, I'm wondering if you could just give us a bit more information about the restaurant closure. What was the reasoning there? And I know you had said that as of last week that masks would now be required on patios, but patios are closed too in HRM. Is that correct?
Absolutely. They're part of that. The restaurants aren't entirely closed. They're closed for seated service.
Go ahead with your follow-up, Victoria.
And how is this lockdown? Is it any different than the last lockdown circuit breaker that we had here in HRM? Are there any differences other than now some schools being closed?
There's a lot of similarities, but we're stronger in some of the areas about just you're closing things down rather than limiting their activities. And I think the emphasis because of that is simply because we're dealing with a variant. They're more infectious, and we have to be firmer earlier on in the whole course of an outbreak.
Next question will go to Pat Healy with the Laker.
Hello, thank you. This question's for Dr. Strang. I see that Milford, Lance, Enfield, and Emsdale are included in the restricted area as well as HRM. Why are they included? Is there evidence of spread in these communities?
We don't yet have evidence of spread in those communities, but we look at the pattern of how people travel. Those communities, even though they're technically part of another municipality, they really all are part of suburban Halifax, and many people in those communities, they do a lot of their shopping, they come to work in the Halifax area. It only makes sense that when we're looking to tighten restrictions and prevent broader spread, that because of that part of that movement of people generally throughout HRM, that they be part of the restrictions.
Go ahead with your follow-up, Pat.
This next question is for either Dr. Strang or Premier Rankin. Given the last few days, are we doing enough to check in on people who are supposed to be isolating? Should there be more consequences for those who aren't?
We continue to do. We have everybody who's under quarantine has to do a daily digital check-in. If we don't hear from people, that is past. We reach out to them, and if we're still not able to be in contact with them, we then pass it on to local law enforcement. So we'll continue to do that. I think we have robust oversight. It's not 100%. We other than having somebody, an enforcement person outside the residence of every single person who's quarantined, you do have to have some. Put your trust in people, and by and large, we have had good compliance. Unfortunately, we were doing a circumstance where we've had poor compliance has led to a significant spread of the virus. So we're continuing to look at how we might improve that. But I think by and large, we have good compliance. I do want to say again my statement though that many people who are coming here, especially people who are coming to visit family and friends, there are Nova Scotians who know about those visitors and also should be helping those people enforce or not enforce, but helping those people stay in quarantine, but by being very careful that they don't come into contact with those visitors. The other piece of this, of course, is we're shutting down our borders to non-essential travel, so there'll be much fewer of these discretionary travelers that will have to monitor their quarantine.
Next question will go to Jean Laroche with CBC.
Good afternoon, Dr. Strang. I just want to follow up on some of the questions that my colleagues have put about this family that had visitors from Ontario. We've had 63, by my count, new infections over the past couple of days. How many of those 63 are tied to that complicated or that gathering that shouldn't have happened with this family?
Yeah, first of all, I've never used the word family. There was a gathering that people from out of province were at. We've tied a number of our cases back, but some of them the links are somewhat tenuous. They're not fully formed, and so we can only and I don't have we don't have a firm number in terms of, but we do know that in a number of our cases that we can link them back in all likelihood to this unfortunate gathering. To me, it doesn't matter how many exactly. We know that has been a significant driver of a lot of our activity, but not the only driver. There's other sources as well. The reality is we're here, we have community spread, and we now have to deal with that and get it back under control.
Go ahead with your follow-up, Sean.
And Dr. Strang, you mentioned the variants and how that has changed the water on the beans. Can you talk a little bit about, because we've gone through at least 2 lockdowns here in Halifax prior to this, but this one is different. And I want you to talk about, or to explain, please, why they're different and why variants make a difference.
Well, they're different. I'll tell you, because I was talking to my medical officer of health team this morning, and they're saying they're seeing in cases in general that there is transmission, but at levels of contact that we would have previously considered probably moderate risk. But we're still having a significant number of those cases where there is actually transmission. So we're seeing easier transmission. We're also seeing, which we know, these variants are significantly more infectious, more able to spread from person to person. We're also seeing cases where there's much shorter incubation period. So the time between somebody becoming infected and then themselves being able to spread the virus to another person is shortened down. And what that means is that one person may infect another person, and then they can go on to affect other people, and that can happen in rapid succession. It's very hard to stay on top of that from public health when we're trying to get people tested and then follow them up and then identify their contacts, and there may be a couple of generations of exposure in that time period. So the increased infectiousness and the speed at which this can go in cycles of transmission make this very more challenging to stay out in front of.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Chrissy, and I want to thank Nova Scotians, especially those who continue to follow public health protocols. It's allowing us to catch cases early on when you go out for your testing, and we can track the contacts. We're actively increasing testing capacity, and we'll look at more opportunities to expand testing like we have with the Halifax Regional Fire Department. But everyone must follow these protocols. We cannot lay blame on people that have come here from out of province for the rise in cases. Some chose to socialize with those from out of province. So the reality is we must come together to take ownership now and beat this virus once and for all. We continue to have the appropriate restrictions in place, and we will not hesitate to do so. But those restrictions need to be followed in order to work. Some are disappointed not to have our world-class athletes compete here against people from all over the world. I am too disappointed. I hope that can happen another time when we are not experiencing an increase of COVID variants. But I cannot permit that while at the same time asking Nova Scotians to stay home and not to travel in and out of HRM. These decisions will continue to be made with the best interests of public safety, your safety. We have been here before, and I am optimistic that with discipline and patience we can do it again. Do your part and stay home. Unless you're going out, of course, to get your vaccine or you're going out to get tested. Your travel should be limited to essential travel and no travel in and out of HRM. Go outside, go to a park. It's Earth Day. We just announced 60 new provincial parks and wilderness areas. So please get out and enjoy nature. And I have faith in you as Nova Scotians to stop this third wave in its tracks. Thank you.